Females that donate their kidneys are at risk of what? They are at risk of gestational kidney issues. Many infants have decreased frequency of poops 1 month after birth. Is that an issue or is it fine? It's fine. What vascular structure often results in cranial nerve 3 palsy? A posterior communicating artery aneurysm often results in cranial nerve 3 palsy. Patients with hemodynamic instability and hematochezia should get what sort of imaging? An esophagogastroduodenoscopy. Hinox-Schlallen purpura should be on the differential of patients with purpura on their butt and legs. If you suspect child abuse, what do you want to do? Get the kid care and then to CPS. If you get any question and there's no obvious muscle injury or life-threatening issue in the past, just give the statin, basically. If you see statin as an option, it's highly likely it's the answer. What hereditary condition is associated with many clinical issues, including arthritis? That's too broad. Let me narrow it down for you. It starts with an H. Hereditary hemochromatosis is associated with many clinical issues, including arthritis. Also note that hereditary hemochromatosis is associated with this sort of cancer, which is what? Hepatocellular carcinoma, right? Subclinical hypothyroidism should be expected in patients with vague symptoms. So what do you want to check? Check the anti-thyroid peroxidase antibody levels. Subclinical hypothyroidism is associated with recurrent spontaneous miscarriages, okay? You got to know that. What's an X-linked recessive disease that is common with regards to blood disorders? Hemophilia A, right? Hemophilia A is an X-linked recessive disease common for blood disorders. In obvious instances, you may need to notify the state medical board of bad physicians. Is that true or false? It's definitely true. What is a common cause of death after motor vehicle accidents? It's a type of injury. I'll give you a clue. It's not flail chest, but it's in that sort of region. Aortic injury, right? Common cause of death after a motor vehicle accident. Patients showing signs of Whipple's triad should receive oral hypoglycemic agent screening, okay? IV fluids and pressors for an injured hypotensive patient that does not want blood transfusion is a good treatment modality. But note that children should receive life-saving therapy even if their parents don't want them to receive that life-saving therapy. For example, a kid of somebody who's a Jehovah's Witness, you give that kid blood if it's going to save their life. So transfuse that Jehovah's Witness kid. What neural issue is associated with cafe au lait spots and bilateral deafness? Neural fibromatosis type 2 is associated with cafe au lait and bilateral deafness. P-values greater than what are statistically significant? 0.05, right? P-values greater than 0.05 are statistically significant. SSRIs can cause sexual dysfunction, so what do you need to do in that case? Switch to bupropion or mirtazapine. Chronic exposure to what can cause Barrett's esophagus? Chronic gastric acid exposure can cause Barrett's esophagus. ECG of a kid with approximately 3 Hz generalized spike in wave activity should be placed on what? Ethosuximide, right? Because that's an absence seizure, right? What kind of conjunctivitis typically has a viral prodrome? Obviously, that would be viral conjunctivitis. And patients with viral conjunctivitis are not contagious after what? What needs to resolve? The eye discharge needs to resolve. After that, they're not contagious. Combination nicotine replacement and behavioral support is a good option for smoking cessation, okay? Combination nicotine replacement and behavioral support is a good option to get your patient to stop smoking. True or false? Being immobilized for a long time can lead to hypercalcemia. That's true. Staying still for a long time in your bed, long time, get hypercalcemia. Strenuous exercise, can that cause hematuria? Yes, it can. So if you see hematuria in a patient who's just like finished at the gym, get a repeat UA in like a week, right? So follow up. Is chronic urticaria a clinical diagnosis? Yep, it is. And how do you treat chronic urticaria? What medication that starts with a C? Cetirizine daily is used to treat urticaria. And how long in general does it take for most patients with chronic urticaria to have their symptoms spontaneously resolve? It takes 2 to 5 years. What is the best treatment for RSV bronchiolitis? Would be supportive care. What is the best way to diagnose RSV bronchiolitis? History and physical exam. What is a common sign of RSV bronchiolitis? Recurrent wheezing, right? Recurrent wheezing is seen in kids that have had RSV bronchiolitis. A patient with a severe gallstone pancreatitis should get what? Should get a cholecystectomy. An anti-nuclear antibody screen should be done on patients suspected of having what condition that starts with an L? Lupus. So if you suspect your patient has lupus, you should get an anti-nuclear antibody screen. Note that it is fine to attend social gatherings of some patients. Just be professional. Like if your patient for 5 years or whatever wants you to come to their wedding or their kid's bar mitzvah or whatever, it's fine to go. A patient with a rectal prolapse, does that require surgery? Yep, it does. How do you confirm pleural TB? With a biopsy. In general, how are anal abscesses treated? They are incised and drained. Are patients with anal abscesses at risk of getting something that starts with an F? Yeah, they are at risk of getting fistulas. So be on the lookout for that.